Hey y'all, I get this question a lot from my students when they are trying to study the layers of the teeth, okay, or a tooth, the layers of the tooth. They struggle with that. So I created this video to talk us all through the layers of the teeth so that you can clearly understand how you're going from the outside in. My name is Ruby Jones, and I am your favorite dental diva who has had nearly 15 years of chairside experience as a dental assistant, who has made a lot of mistakes along the way. So I created this YouTube channel to help you, current and older or established dental assistants, never lose touch of your game, and basically to avoid making some of the mistakes and the little growth humps that I have experienced. So I hope you stay tuned. All right, y'all, let's get straight to it. So when we're talking about the layers of the teeth, I know that it can be very confusing and just hard to remember. So again, let's get to the first layer. The very hard exterior layer of the teeth is called enamel. Okay, so the thing is to remember that enamel covers just the crown portion of a tooth. Okay, so looking at it this way, the crown is the very visible portion of the tooth, basically the portion of the tooth that is above the gum line. Okay, so when a patient smiles, or if we're just looking in the mouth, for the most part, what we are looking at is the crown of the tooth. And again, enamel is the layer that covers just the crown. Making sure you understand, enamel covers the crown and it does not continue on down through the root. Okay, so again, the crown is the portion of the tooth above the gum line, and the root is going to be the portion of the tooth that is embedded in bone under the gums. Okay, so for the most part, sometimes we can, but we should not be able to just see the root. Okay, of course, if we do, that's something totally different. We talk about during the perio chapter where we're talking about root exposure, which is necessarily not a good thing, sometimes very uncomfortable. So we are talking about the standard healthy tooth. Crown is above the gum line, root is below the gum line, and together, so crown plus root equals the entire tooth. Okay, and the portion of the outer layer that covers just the crown is again the enamel layer. The layer, I should say, of the tooth that covers the root is going to be called cementum. Cementum covers the root, enamel covers the crown. Okay, so remember that. So this little area here called the CEJ, the cemento-enamel junction, is the line where enamel basically transitions to cementum, or vice versa. Cementum transitions over to enamel. So it's basically like the border, you guys. Like if we're traveling, driving from one state to another. Here I'm in North Carolina, so if I'm driving to South Carolina, the moment where I see that sign, welcome to South Carolina, I have traveled over to another state. That is what you can imagine the CEJ is, the cemento-enamel junction, where the cementum covering the root transitions to enamel, or like I said, vice versa. Okay, so that is the outer layer, and as we travel in, this very yellow, they call it covers the bulk of the tooth. It basically takes up a lot of space when it comes to a tooth, is going to be the dentin layer. Dentin is also the layer of sensitivity. Okay, so you'll notice patients who have a weak or very thin enamel have very sensitive teeth. They are not really loving or having a great experience when they're drinking something hot or cold, or enjoying ice cream for dessert, that type of thing, because the enamel layer is thinner or non-existent, or just sensitive for whatever reason. Could be several different reasons, but basically, I just want you to understand that that sensitivity is the response that the dentin layer of the tooth is giving, or that's why the patient is having these symptoms, okay? It's the dentin layer that's responding. Okay, so enamel, dentin, and this, you guys, is the nerve, or what we call the pulp, okay? And you have to section the pulp off. So here, the portion of the pulp that is in the crown is called the pulp chamber. The pulp chamber is the portion of the pulp that resides or lives in the crown portion of the tooth. And then you have your pulp canals in this instance, because this is a molar tooth. So the pulp canals reside in the root. So again, how I just taught you about the enamel covering the crown, the portion of the pulp in the crown is pulp chamber, and the portion of the pulp that is in the root is called or classified as the pulp canal. Okay, so you put it together. Pulp canal plus pulp chamber equals the pulp or the nerve. Okay, so I hope that helps you. I hope that helps you understand, because again, like I said, it's just sectioned off in that way. And so if you understand the details of the term, when you pull back, you're like, okay, pulp chamber, pulp canal equals the pulp equals the entire nerve. I get it. Just like when you think about crown and root equals the entire tooth. So you have to be able to see the sections alone, but also put both puzzle pieces together so that you can get the full picture. Okay, so hopefully going through the layers of the teeth was very helpful for you. Let me know if there's anything else that you want. Of course, there's way more to go through, but that is, I feel like, is the main ones to make sure you understand. So if there's anything else that you need me to go over, comment, send me an email, let me know, and I got you. Thank you so much for listening.